because we are talking rallies, right? So outdoors, it happened like one time, and it's literally somebody who was in the presence of someone else for like longer than 10 minutes. I mean, and you have to be really in close proximity to that person. So when you're in a rally, you're outdoors, there's, sunshine and breeze and everything. So unless somebody's literally coughing on you or sneezing in your face, chances are you're fine. And a lot of people do wear masks. A lot of people don't. A lot of people do. I don't. I don't feel the need outdoors whatsoever. And again, nobody's in my face or sneezing or coughing right at me. But it's yeah. I mean, to make that point, I don't think that going to rallies is going to make anybody sick any
No,
more
it'll make
than
some people, statistically, some people are going to, I mean, enough people go to enough rallies, people get sick.
right. Okay, that's fine.
All right, I haven't had any coffee, so somebody else is going to have to start off with something.
Maya, you're
Well,
our our honored guest. Why don't you start off with telling us? Now, I had heard, actually, I have a question for you. This morning, I heard a report from a lawyer on the radio that they have
okay.
begun, uh, uh, they have withdrawn any permit to protest in California, and that they've started arresting protesters and dragging them off to jail. Now, this isn't, this was on the news, so it's, I mean, it's not, I'm not, it wasn't some kook that just had some fantasy on Facebook.
Right.
Have you heard anything about it, Maya?
Well, to be honest, I have not, and I'm actually shocked and very, very disturbed by to hear something like that. However, I would say that I did see a video from New York. People, I think in Central Park, were trying to protest, and it was just the most mild, most protest that I have seen. And there was plenty of space between people, and New York police was shooing them off and telling them, if you don't, this is a non-essential gathering, and if you do not disperse, you will be arrested and so forth. And people were being put in handcuffs.
Yeah.
So that is very disturbing to me to hear something like that. I don't believe that, like, in this country, we've so quickly reached the police state of affairs that we're in. That is very, very distressing.
Yeah, well,
It
they're
makes me
doing it. They're
horribly
doing it
violent.
in California now. The governor was displeased by our lack of enthusiasm, and so on the pretext that he's saving us from ourselves, he's
Right.
decided to withdraw any permits. Apparently, you need a permit to peacefully protest, and he's not allowing it anymore. And yeah, they were handcuffing and taking off to jail Californians that assembled peacefully
Where did you see
to
this?
protest. I heard it on KRLA. It's a radio station. It has news.
Yeah,
It's
because
a
I
news
mean, I've
station.
tried, I look at a lot of places and I didn't see, but anyway.
Yeah,
Oh,
I
like I
also
said,
Petty Garcetti, the mayor of our city, has also mentioned that he mentioned this a month ago that if you try to open your business, he would shut down the power, the electricity, and water, and that they're tracking people by cell phone use. He announced this. He was openly
right.
said that's how we can tell the size of the assemblies,
Mhm.
and that they will come and raid whatever assembly you have. I'm not done. They're also discussing plans to make vaccination mandatory, which means that it's not that they'll force you to do it. It's just that you may not be able to register your car, or I don't know. They'll have ways of sort of making
That's
your life
absurdity.
miserable if you don't. They're
well, okay. Well, that
also
sounds like something we can get into a big fight about. So, what would be the now? Obviously, if they're able to get a vaccine out by say election day, odds are that it won't be a perfect vaccine. I mean, the flu vaccine in general is imperfect.
Correct.
Though, well, but that's because it's anticipatory. They're just trying to guess what strain is going to be the big strain of the year. This one, well, for different reasons, it's probably not going to be perfect. Um, Besides that, if there were problems with the swine flu vaccine, I think it gave a few people Guillain-Barré syndrome, which is a kind of paralysis. I may not be remembering that right at all. But anyway, so let's say the vaccine is, I don't know, only fucks up one person in 100,000 and is 80% effective. What do you think of that vaccine?
Well, I think, I mean, you definitely are speculating, right? But right
Yeah,
now, I mean, the vaccine that we had for the flu, I think about 40 to 50% of the population is getting that vaccine on an annually, correct?
yeah,
Something
yeah.
like that. And I think some years, and this is according to the CDC, it's only like 30, it has little to no effect. So it's like 30% of the people who are getting it are actually vaccinated at that point. So you're looking at little to no effect. And this is with something that we've had for decades.
Yeah, though I kind of misspoke initially in that it takes months to grow enough vaccine. They have to grow it in chicken eggs. It's like
Right.
this huge industrial process, plus with biology stacked on top of it. And they have to guess what flu mutations, varieties of flu are going to be the big flus for that year, because every year it's a different mix of them.
Right.
And they in the vaccine they put in the killers of these particular strains, and sometimes they get it more right than others. You'd think, since they're only going after a few strains of coronavirus, one strain that they know, maybe two, and maybe what they think it might mutate into, they might be able to target it more specifically. But they still have to grow all the billions of eggs to get the doses for everybody, or infect all the egg.
Right. And then you're going to have all the human studies that have to go into that, right? You can't just,
Yeah.
bring it out there and say, okay, now it's effective, so go to it. And I mean, it's still not going to be the quote unquote cure that people are looking for. So it's still going to have, the virus itself is going to have a prevalence within the population once the population is out of lockdown. And by the way, once we are out of lockdown, which, let's be honest, we cannot sustain this,
Hmm.
on any level, not human, not economic, not any level at all, um, you are going to have people with weakened immune systems now out in the population. So rather than, I mean, I'm straying a little bit off the subject, but rather than going via the, let's say, the Sweden way, or other people who haven't completely locked down and actually have allowed the virus go through naturally like it normally would, and maybe protect the most vulnerable, etc., but let the normal, young healthy population let the virus go through
Well,
that
I
population,
guess
as you would expect. Now we have that population not having any immune system whatsoever. Now they're weaker,
well,
and
I
now
guess
you're
what I'm
looking.
asking is, what's the matter with, like, the governor saying, look, if you want to work in food services, if you want to be a waiter or a chef, we've got this vaccine. Um, it works in 80% of people. And if you want to work in a restaurant, or you're gonna have to get the vaccine. I assume that
um, Go ahead.
no, I assume that that's kind of what the situation, that people who want to engage in fully opened up public life, um, might be expected to get a vaccine. And Lance, you were saying that's indicative of a police state, I guess.
Yeah, pretty much. I think that the more we learn about this virus, the more it turns out that it's basically very similar to flu. hang on. Let me just hang on. All right. It's basically very similar to the flu. Hang on, I gotta stop YouTube here. I was gonna look. I'm looking right now for a name of an epidemiologist. Um, because this afternoon I listened to a lecture from one of the foremost epidemiologists, and this guy is going to be advising the president through an intermediary. There's a doctor from Bakersfield that has become very famous.
Or is that
Anyway,
Dr. Erickson?
Dr. What?
Erickson? And
Yeah,
he was talking
Dr.
to
Erickson
Dr.
is
Mikowitz or something, Mikulski or something like
Witkauer or
that.
something from
Mikulski,
Germany.
yeah, there you go.
Yeah.
Yeah, I heard
Anyway,
that. Sure.
they have you heard the lecture? Anyway, it
Yeah,
turns
the
out
interview of Erickson with Mikulski. Yeah, I heard that one.
Witkowski, yeah, he says that the virus is not much different from the flu. That
Mhm.
it's in its if we hadn't given it so much publicity, a lot of people would simply be referring to it as a new strain of flu, and that
Right.
the whole thing has been a massive overreaction. And he cites Sweden and Florida and a lot of other. Is that you or me?
I think that's
Who's
you.
what's making music there? Cut that out, director.
Okay, all right, okay, let's keep going. Let's keep
Yeah, but
going.
Mike, it distracts me. Anyway, this epidemiologist says that this is basically a massive overreaction that Sweden and other countries, areas that haven't locked down, ended up having a severe flu season, and that was it. And that
Right.
all the dire predictions that were made did not come true. And so I object to any more fucking with me by the government. I've had it. I don't want them involved with me at all anymore. They've already overstepped their boundaries on something that I believe they made up. I think that
Absolutely.
I think that an argument could have been made that at the very beginning, when we didn't know what the hell we were dealing with, that a few weeks of shutting down and analyzing it was not necessarily the right thing to do, but it was a reasonable thing to try. But it turns out that no. Now that they know, uh, Trump's lockdown ended April 29th. And I'm listening to Petty Garcetti and Gruesome Newsom talking about maybe not ending the lockdown for a few more months, maybe waiting until there's a vaccine a year from now. I've heard
You're
them
already
say
opening
things
up
like
parts, but
this.
anyway.
Well,
Now,
here's the
now
All right.
answer your original question. Actually, there were two of them. Were first of all about the shutting down of the utilities to a business that's open. I saw a post in Reopen California today. There was a business, but it wasn't here in LA. It was in Sacramento, and somebody opened their business, and of course they were fined like $1,000, and the customers pitched in and wanted to pay that fine for the owner of the
What
business.
was the
And
business?
it was like a chicken place, chicken wings, something like that. And so the customer said, "We'll pay your fine," and they all chipped in, and here's $1,000 or whatever it was. And then the city came in and shut off their water. So Sacramento actually apparently did do that. Now going back to your question about requiring, like say, food workers to get vaccinated. If you want to require food workers, like if you have a beard cover, or if you have or if whatever, like covered with a mask. If you cover your face with a mask, pull your hair back, put a net on your hair, that's reasonable. To ask people to put something into their body that they may or may not want, need, or require, that's an overreach. That's overstep. So even if you are in the food industry, again, if you're wearing a mask, if you're wearing hairnet, if you're wearing gloves when you're handling food, washing your hands in between, changing gloves, etc., that should be more than sufficient. You should not require people to inject themselves with something that they may have a reaction to, or may have a resistance for anyway. So I mean, it's unnecessary, and it is forcing people to do something that up until 2 months ago you wouldn't have even considered, and now all of a
All right.
sudden
Well,
it's
we're nowhere near. nobody's saying that we're going to get a vaccine in the next few months anyhow.
Well, that's
And
true.
we don't know how what rules are going to go with it, who's going to get it, how many vaccines are going to be available. But let's go back to mortality. Lance was talking about, like, he's got these epidemiologists who are saying it's just a bad flu season. We've been losing 12 to 15,000 Americans have been dying a week for the past 3-4 weeks, and if that let's say that it's going to settle down and it's only 1,000 a day, 7,000 a week between now and election day. That's still 260,000 dead Americans by election day, by November, um, which would make it the second deadliest pandemic in history. Uh, right now, this is the worst year for deaths from respiratory disease since 1969. Um, and so, yeah, you can say it's like a bad flu season, but it's like the worst flu season in more than 50 years.
All right, I'd
Well,
like
okay,
to respond to that. Maya,
okay, go ahead.
all right,
Well, I was just
all
gonna
right,
say, I was
Maya,
just gonna say, I don't
okay,
trust the
go ahead.
numbers coming out. I don't like how they're counting it. They keep adding numbers to the total without any testing. They keep just inflating the numbers to the point where, I mean, you have somebody who comes in with terminal cancer, and they know that that's what that person died from, and they're still saying, no, 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 we're gonna put it down as a COVID death. So as far as 1,000 a day or 1,200 a day or whatever it is, I don't trust those numbers because I know they've been inflating them. It's been proven already. They told us anybody that dies with COVID is not the same as dying from COVID, and yet that is what it's being counted as. So
Well, that's certainly true because that was announced by Scarf Lady, that she
correct.
said that, if someone dies, but they are a carrier of COVID, then it's marked as a COVID death. And it turns out that they estimate that 25% of the population in the big cities is already carrying the COVID, either antibodies to it or is a non-symptom carrier of it. So there are lots and lots and lots of people that have it and are dying. So that is I'm backing up Maya there. But I'd like to go on to something I've been
Well, no,
developing
hold on,
now.
because we got to argue about that because there's a thing called excess mortality, where the actuaries and demographers and epidemiologists have a really good idea after years of accumulating data of about how many people are dead by this date on average every year. And you compare the number of deaths by this point in the year to the number of deaths in all the previous years. And we have a lot of what they call excess mortality. And something is killing a shitload more people than normally die by this time.
Well,
And now hold on, it can be a lot of stuff. It could be some people are saying that some more people are dying of heart attacks because they're reluctant to go to an emergency room where they might get infected. That's and there are things that add death and there are things that subtract death from the overall number of deaths. It's been a light year for flu because the same social distancing that helps slow down COVID slows down flu. So 2 years ago, there were 60,000 flu deaths. This year, 24,000, according to best estimates. This year, there are probably fewer traffic deaths because there's less traffic. Um, but overall, something has killed, roughly 100,000 more Americans at this point in the year than had had died in previous years by, what is it, May 10th. So you can argue, yeah, that maybe some people, like I said, I saw the death certificate for my homeless brother-in-law who had 6 causes of death listed because by the time they got him off the street, everything was wrong with him. And you could argue that with somebody who's got a lot of shit wrong with them, which is the thing that really killed him. But at the same time, just a shitload of people are dying above the average.
Okay, Rick, I'm going to respond again. Uh, the the reason that some people think we're having such an incredibly mild flu season is because people that are dying of the flu are being listed as having COVID. So we're probably having there are a lot of people that are saying that we're having a very severe flu season and that we're counting those deaths as Wuhan virus. So if you look at the CDC, they have a chart, a table that lists all deaths from respiratory illnesses this year. They still say last week I told you it was 38,000 purely from COVID. Now it's up to 43,000 purely from COVID. And then they say that there are a lot of deaths from flu and pneumonia. Okay, and in fact, they've got a category, the largest category on the table is a category where they don't know whether it was flu, COVID, or pneumonia. That's the
It
largest
was
category.
respiratory,
Right,
yeah.
and they're making it
Yeah,
COVID just in case.
yeah. Now I want to develop something else because this deals with the mortality. Really there are two questions. The first is Witkowski, who's a major epidemiologist, says, look, um, once we end the lockdown, the virus will spend itself out, having already peaked, the way that all flu seasons peter out. Your side says no, it'll just go on forever. People will continue to get it, and it will just never stop. Now, I have to tell you that I believe that it's going to be it's going to peter out because all the other flu seasons in my 59 years on this planet have just petered out. Now, I don't have any science behind that. You're going to have to take your pick who you believe, but I don't think it's going to keep being 2,000 people a day for the rest of our lives, until everyone on the planet is dead. That to me sounds unreasonable. But
And
beyond, all right, say what you want to say, Maya, but then I have something very important to say.
well,
Go
I
ahead.
was going to let you finish, but I was going to just add that the rate of mortality from excessively elderly people with comorbidities and so forth in nursery homes, if all we did is just protect that part of the population, we're already cutting down the mortality rate by like 40% or something,
All right, now,
because that's really where we
excellent.
get the majority of that. So anyway, go
That's
ahead.
that's a great introduction, Maya, because that's what I've been developing now for the past 4 weeks. On March 29th, there was a governor edict in New York, New Jersey, Pennsylvania, and California stating that COVID patients could not be refused admittance to nursing homes. Now, it looks like roughly half of the deaths from Wuhan or COVID, but I like to call it Wuhan, have been
Yeah,
from
because racist, okay, or just because.
because elderly people died in nursing homes. I'm going to say that again because Rick was calling me a racist.
Now, you know what? No, just but like
I'm gonna no, I'm
deflecting.
gonna Rick. Actually, I'm gonna
You know
say it
what? Let me
again.
take it
Rick,
back. Let me take
Rick.
it back. Yeah, I'd say rather than racist, it's kind of deflecting blame.
Okay, Rick. I'm gonna say it again. It turns out that four governors of four Democrat states, New York, New Jersey, California, and Pennsylvania, all Democrats, instituted a policy on March 29th. And I didn't read this, by the way, in Fox News. It's not a conspiracy theory. I heard it at the time. on March 29th. I remember it coming over the radio. Yeah, because they thought it was discriminatory. Like you, Rick. They were afraid of being politically incorrect. Just as you insulted me right now. They were acting like you. They didn't want to be politically incorrect, so they said, we will not discriminate against people that have Wuhan. And so we're going to shove them into the nursing homes. And 40%, maybe higher than 50% of the deaths in this country are from those governors' edicts. So whatever number you have would be roughly half if it wasn't for the Democrats that created those scores of thousands of deaths. Probably 40,000 of those deaths were caused by Democrat governors who wanted to be non-discriminatory.
No, well, no, I disagree with your numbers because New York, the worst hit state, is only a third of all deaths. And I mean, like you have nursing homes in
If
the
you
other
combine,
46.
Rick, if you combine New Jersey, New York, Pennsylvania, and California, that's more than half by a long shot of all the deaths in the United States. So we'd be dealing with a very mild flu season if it
Yeah,
wasn't
okay,
for
okay. So that,
Democrats.
yeah,
Well, in addition
but
to that, also I would just add
so,
that
but
New
all
York
right.
is. I'm sorry. Go ahead, Rick. Do you want to
So
finish what you?
so say you've got 80,000 dead so far, and let's say 45,000 of those are in those four states, and 40% of that 45,000 is 18,000. So what you're arguing is that the fuck ups of these four Democratic governors are responsible for up to say a quarter of the 80,000 deaths if you do the math.
Actually, in
It's still a significant
Pennsylvania,
number,
it's
though.
60%, and in New
Still,
York, it's 40%.
In New York, it's a very large number, and from what
Yeah.
I heard, and I'm not sure, I have to, I don't want to just cite things just offhand, but the New York wasn't reporting what percentage of their total deaths are um, nursing home deaths. They didn't want that information out because their governor was making them the nursing homes take those patients that have been tested positive, taking it back. So I mean that was mandated by the government. So and they weren't reporting it. But if you go state by state by state, not even just does the four states that Lance pointed out, but go state by state by state, out of all the total deaths, it's anywhere between 30 to 60% are from nursing home or older population that has other
okay,
comorbidities that was
all right,
exposed
but
due to.
I mean, that's 46 states where the governors weren't saying you had to put. I guess maybe there are some other governors who, or mayors, or who knows what, said. Um, anyway,
Right, but the
it's
point is that if you weren't to lock down everything and everyone and just basically trample all over the Bill of Rights completely like it never existed, I mean, right now, like I said, New York is arresting people in the park for being outside. That's it. That's
well,
it. That's their
I
crime.
can't. I mean, this show is about getting into fights, but I really can't get into fights with you about the general principle of opening places up as we learn how to do that reasonably safely. And yeah, we've been locked down for 2 months now.
But right, but we
And
knew that the vulnerable population was the older population. So rather than locking up the young and healthy population, like putting everybody under house arrest, basically, all they had to do is be reasonable about it, have a normal measured approach. Would have been, we know from Italy, from Spain, we know who the vulnerable population is. Protect them, require additional measures to, whether it's for the nurses and the doctors who work there, or any kind of workers, protect those people, and then let everybody else live their lives. Because when you were saying excess death, I was thinking there's certain deaths that we will never be able to measure, whether it's from people falling into this. I mean, I'm sure you guys have
sure,
covered like
sure.
the despair, the alcoholism, the drug abuse, the child abuse, the spousal abuse, all of the stuff that just skyrocketed in the last couple months, to the point where, if I was a lawyer right now, I'm getting into family law
Yeah.
because like this is, I mean,
Okay, so
the,
but
the
what I'm
costs to
saying is that
society are
I'm
outweigh
not
the.
I'm not
Go ahead.
fighting with you about saying that. I mean, my wife hasn't seen. We haven't seen her mother-in-law. She's seen her once in the past 2 months because her senior living place is under a severe lockdown, as it should be, because
Right.
you don't want even one case in that frickin' place. Um, and as far as the rest of everything, I mean, and maybe, you know, I mean, maybe the time to look at how to open places up is now or should have been earlier, but like I feel like, that's what we're going to work through. And some people are going to be like, we're opening up too fast. Some people are going to be like, we're not opening up fast enough. But I mean, ideally,
Hmm.
that we open up based on best, available information.
Well, can I suggest
Or
one thing
maybe,
then?
what's that?
Go ahead. No, no, no.
I mean,
Finish
but
the thought.
obviously you can't, that's ideally. Obviously, in real life, you're never going to have adequate information. But we'll find out more and more the longer it goes on. And I mean, you guys have been to 5 of these rallies, and I wouldn't go within a 500 yards of one of those frickin' things. But we'll find out from about the rallies. Like you read stories like this church, or like South Korea has been really good at testing and contact tracing, and they were doing really well. And now all of a sudden they've got a new outbreak because one fucking typhoid Mary guy went to 5 discos and infected 43 people, which is bad. At the same
Which health
time, it's
authority
good
can he? Go ahead.
because
I'm
they
sorry,
know
Frank.
the guy and they know the 43 people he infected.
Okay. I'm
So
not in favor of contact tracing myself. I think again that's people getting into your business that should have no business getting into. But at the same time, if you think about it, chances are 99% of those people are going to be 99% okay. The chances are whoever he infected, yes, even if you get a spike in cases, doesn't mean you get a spike in death. So if the death
yeah,
remains the same and you have more number of cases, so what? Nothing changed. We've always had that. But when you're going back to your measured, opening by, certain rules and that sort of thing, if you think about it, our way of life, all of our freedoms, First Amendment, everything has been taken away overnight, like that, like it's just gone, right? I mean, everything. You can't go here, you can't go there. There's no public, something like a public beach. It's not public if I can't go there. It's not right. But now that they've taken everything away at once, it's like a parent that's telling a child that's misbehaved, I'm taking away all your toys, and now here's one little toy. Now you're gonna be a good little boy. Okay, here's another one. Maybe if you behave well for the next 2 weeks, I'll give you one more toy. And I think at that point, like we really have been treated, like you said, but whether it's governors, and it's not just our governor and our mayor, but I mean, you've seen what's going on in Michigan, you've seen what's going on, and there's so many places where people are just completely drunk with power. I mean, you've got Lori, what's her face, in Chicago, Lightfoot, that's yelling at her constituents like, I will hold you to jail. She literally said that. I mean, you've seen that, I'm sure, the press conference that she gave, and she's telling people, I will haul you to jail. Don't make me take you to jail. Don't, basically telling him, it's like a father saying, don't make me turn his car around. I mean, being treated like a 3-year-old after you've lived in a free country. I'm sorry, like I don't understand. And again, as somebody who's a legal immigrant to this country, somebody who worked very hard to get my citizenship and to get my right, and it's just like, what are you talking about? You just snatched it all away. It's all gone. At the downtown rally when I was in LA a week ago, there were 3 Persian ladies. And man, those Persian ladies had so much fire in them. It was unbelievable because they were just like, they were saying, like, as somebody who came from Iran and somebody who like knows what it's like to not have the right to speak or the right to go where you want to go or do what you want to do, they're like, we're not giving this up without a fight. That's why they're going to these rallies, because we're saying like, okay, if you're going to take my rights away, at least I want to go down fighting. And I mean, and 99% of the time, like I see a ton of American flags, of course. I see the "Don't Tread on Me" flag. I see, people making various signs. Like, I think I sent a few to JD earlier this week about, little kids holding signs saying, my mom's job is essential. Like, All of a sudden, the government is telling you what isn't essential. Since when?
Well,
Since when are you telling a hairdresser they're not essential? Maybe I don't need a haircut, but that hairdresser needs their family be fed. So how are you telling them that's not essential? It's, I mean, I don't understand where and how it is that we allowed our government just come in overnight and tell us what isn't like I'm allowed. Like today, I went to Walmart today. Okay, I was walking around Walmart for probably an hour and a half. There's 100 and I don't know how many thousands people around me, right? So that's okay. That's allowed. And by the way, nobody required that I wearing a mask. If I, most of the people were. If you didn't want to wear one, you didn't wear one, whatever. So you can do that, but you cannot go to the beach because the governor will haul you off to jail, or the mayor, or will put sand on the bike path so that you cannot go to the beach. So how does that even make sense? Since when is how is that about your health? I mean, I think the problem I'm having is that people think that the government all of a sudden just woke up one day and really cares about your health or my health for that reason, for that matter. And what I'm saying is that they're doing it for no reason whatsoever, because when they're telling me you can go to Home Depot, you can go to Walmart, but you can't go to the beach and you can't go hike up a mountain on a what should be a public trail. Like that to me is just maddening and something that I cannot wrap my brain around. I don't understand.
well, all right. So I would argue that the the extreme shutdown was because people, government officials, were afraid of the exponential growth that was being discussed. That if it's 500 people a day now, 3 days from now it's going to be 1,000, then 2,000, then 4,000. And what we've seen for the past month is it's pretty steady on average across the whole country. Now, there are different hot spots, but if you average out the whole country, you're looking at roughly 2,000 deaths a day, plus or minus 500 from day to day. And we have the curve isn't exponential right now. Um, so it so the fear of exponential has not been borne out, though we're still seeing a steady, you know, stream of casualties. But it seems like, yeah, that and 45 states are doing some degree of opening up right now, and
Right.
it seems like, I don't know, that there's room for obviously disagreement in that, but there's also room for for trying stuff. For instance, like we were talking about outside versus inside, and how many particles you have to inhale to get the disease. And so, I don't know, would you have a problem with, somebody says, look, if you want to open your salon, um, if we're going to give you this occupancy, and if you're going to get more than that, like, maybe, some of it goes on, or a restaurant, some of it happens on the sidewalk, or say a church. Like, if you're going to have more than 50 people given an auditorium this size, then maybe you have, it's summer coming, some outdoor,
But they're
services.
not doing that to Walmart. They're not saying Walmart is that's so many square feet, so you only allowed so many people per square foot. They're not doing that to Walmart. Why are they doing it to churches? And by the way, I think you've seen the statistics also about like restaurants. If they're telling restaurants, like in Texas, they're saying, okay, you can open at 25% capacity. We all know that restaurants operate on very just minute margins, like 2 to 5% or something like that sometimes, right? Depending on the restaurant. So if you're telling them they're going to operate on 25% capacity, they're better off not opening at all. You're effectively shutting them down because now it's costing them more to reopen than it is to actually stay closed.
Well, I don't know, because like in Studio City, we had, at least a month ago, there was a list of 72 restaurants that were
Okay.
open with 0% capacity, open just for takeout and pickup, or for delivery and pickup. Um, and I would think that there are plenty of restaurants who would be okay with opening with reduced capacity. And
Well, sure,
there are
some, but you're
things.
still choking out the business. You're still suffocating them. You're still effectively killing the business because for a lot of them, the whole point of like say like actually there's walking distance from where my sister lives, there's like a Chinese buffet, right? Speaking of Chinese buffet, so we loved
I
having
don't know
that
what you
nearby.
do. Hold on, because you mentioned like I don't know what you do about frickin' buffets now.
Exactly. What do you do? So now they are open for, they said, they gave us a menu. They said, we're open for takeout. But you effectively killed their business because the whole point of a buffet, so I can go, I can choose whatever I want. I can have one bite of this, I can have two bites of that. Now I have to order from a menu. I'm probably not going to do it because that's not the point of that restaurant. You effectively killed that business for literally no reason. Because
Well, the
again, the people
virus,
who
I mean, there's an accomplice to killing the business, and that's the fucking virus.
Right,
Act-
but again, look, your annual flu season or whatever other viruses there are. I mean, for so many years we've had all these various different viruses that we've never ever done this experiment where we're basically shutting down healthy population and not letting people develop immunity and not letting people um, go about them and make a choice for themselves whether or not I want to take the risk of going into that restaurant, regardless of how full it is. It should be my choice, just as it is your choice to stay in and not patronize the restaurant. That's fine. Why is it that not my choice then to put, I mean, think about it. Is it
Well,
ever
because
safe to ride a
this, I
motorcycle?
mean, because if you let this, now, the number that was mentioned by Trump early on, that if nobody did anything, that we were looking at between a million and 2.2 million dead overall in this country. And I don't know if that
Right,
number's
that was
been
the
revised,
original, yeah.
but but
Yeah, that was the
but
original study from Oxford or something, whatever that was. Yeah.
yeah, and I obviously you don't do nothing.
Right.
Um, but right now, if the rate of death drops to 1,000 a day, we're still looking at more than a quarter million by the beginning of November. Um, and that's more than we've had except during one other time in history. Um, and so people are, the first experiment was the first it was shut everything down. Now we bought ourselves enough slack to try more stuff. And like nobody, I don't see any of those protesters at the rallies that you go to
Hmm.
yelling, fuck you, we need to open up the old people's homes. They need their freedom. Nobody's saying that because there's good science and statistics on the side of you don't fucking do that. So everybody's going to carve out their territory. The freedom people are going to say we can do this and we can do that, and the people like everybody's going to die people are going to say we can't do this and that. We'll meet, in an angry middle.
Well, it's not so much angry middle as it is, again, if you're talking about nursing homes versus people who want to go to work. The people who want to go to work are not in nursing homes. So that is actually should not even be part of the equation as far as we're opening the businesses, because people locked up in nursing homes are not patronizing those restaurants, nor do they work in those restaurants. So, like I said, in the rally I went to yesterday, there's a big, I think I sent a picture to JD. There's a big giant sign of these two young ladies that were holding it that said, "I want to work." Like, just, I mean, the whole point of the flattening the curve and making sure we don't get above a certain point where we overwhelm the healthcare system, right? That was the original idea. We've done that. We've proven that there's no way, no how. We have not, and we are not, and we will not overwhelm the healthcare system. We're not at that point. And all we've done is we've prolonged because we went along the right rather than having it spike up all at once. We flattened it, so now we just stretched it out along the x-axis, right? So now it's
Mhm.
just going to take longer for us to go through it, but the area under the curve remains the same. Nobody ever said that less. It's not less people will get it, or less
Well, the,
people will
the
die.
area under
They'll
the
just
curve
won't get it all
remains
at once.
it remains the same until you have a vaccine, and
Right.
then
So, and you said yourself that it's not going to happen in the next month or two or even
right,
8.
yeah.
So again, the idea of locking us down until kingdom come is not the answer. And so again, if we
Hang
flatten the
on for a
curve,
sec.
let's and we know that the
Hang
area
on.
under the curve is the same as far as
Hold
people
on,
Hang
getting
on.
sick. So, oh,
hold on. Do we
sorry,
need to
what?
break? Hold on. There's
Somebody
something
is.
happening with Lance. Lance,
I think he's got food delivery.
Oh, okay. All right. So I would make this argument, or should I wait? Should we stop for a sec while Lance takes a delivery? Uh,
Okay.
Okay. Okay.
All right.
All right. Okay.
Okay.
All right. So I got an argument to make, which is for about a month, the U.S. was doing about 150,000 tests a day for the whole country, which is less than 1/20th of 1%. In the past 10 days, it's nearly doubled. A lot of days we're getting to 300,000 tests a day. Some days it's 230, 250. Still not enough, but at least we're moving in the right direction. And if we could get it to we're a third of the way almost to 1 million tests a day. And you could do a lot in terms of public safety with 1 million tests a day. In a month, you've tested 10% of the population. We're only at 2.5% of everybody tested just once now. If we could get to 1 million or 2 million tests a day, and we have 33 million newly unemployed people, so certainly we have the personnel to do it. And if Trump or whoever becomes president wants to do that War Powers Act where you can order industries to make shit like swabs and reagents, if we could, get like 1.5 million, it's not inconceivable. We're doing 300,000. Let's do 1.5 million tests a day. Let's if you want to if you've got a 6-person insurance office and you've and everybody wants to come into work instead of working from home, you should be able to put your name down and get everybody tested in your office within a week, um, for both active infection and antibodies. And you find out how everybody is. People going back to school in September, or at least in January for that next semester. I mean, part of going to school is living in dorms. I always I went to my hometown school and I was always lazy. And I moved into the dorm late because I was just too lazy to move out of my parents' house every semester. And that was terrible for me because the first 2 weeks of every semester is when everybody has rando sex. All the hookups happen then. And you if if we take away dorms, we're taking away people making really stupid sex decisions that are, can turn out to be some of the greatest dumb sex of your life. So we got to do the dorms. And to do that and to open up businesses, we're going to need to do like at least 1 million tests a day and do contact tracing.
But to
And
what
it,
end?
it's
Can I ask to what end? Because if you test me today and I'm negative today, and you say go back to work, I can go back to work tomorrow, and then you're gonna have to retest me because what if I come in contact with somebody
that's
and
right. So for your insurance office, it's 6 people. Do you need to test all 6 people, once a month? Probably not, depending on, the overall infection rate in the country as a whole. For dorms where you've got like 300, 1,000 people, maybe everybody gets tested once a month. Anybody who comes up positive, obviously they're moved into some other place, the infectee dorm for a while. Um, and everybody going to that school gets charged an extra $200 a semester to pay for all the frickin' testing. Um, but I mean, countries that did testing early and thoroughly, New Zealand, South Korea, have have crazy low mortality rates. And there's no reason. I mean, and I should fucking make the argument. We put people on the moon using fucking technology that's less sophisticated than a frickin' Apple Watch. We can figure out a way to do 1 million tests a day, up from the current rate of 300,000. And yeah, so you do have to test. I mean, everybody in the White House right now is getting tested probably once a day. Certainly, the president and vice president are getting tested, are spitting into a cup once a day. and
Okay,
not
so
everybody,
go ahead.
and so frickin' test your dorm full of kids every 3 weeks, a month, and charge them for it, but give them the college
But we
experience.
already, I know, but you're still talking about population that's least vulnerable to this. Young, strong, healthy adults are going to get the virus. They're going to be sick, and then they're going to be well, just like the flu, just like any kind of a minor cold that you get during the first 2 weeks of school. While you're missing all the fun sex parties, you're also missing all the fun uh, infections that are happening, of course. Like when you have
Well, yeah, but
younger, like,
have you seen their professors? Have you seen the people who work at the library? Those people are vulnerable. Also, they're finding out about a whole bunch of new,
but they also
the
don't come close
kids.
to them. They're not in their face. Their professors are
But
not nowhere near the students. They're standing way over there down, like in the lecture hall. It's not going to be, I mean, or if they want to protect themselves, they should be wearing masks, or they should, don't let the students come near them within, 6 feet or whatever it is. But again,
what's the matter with testing the fucking kids? And they're finding out that the virus, if it doesn't kill you, and it kills kids at a lower rate, it is giving kids
much
they're finding out about these other syndromes that may be associated with having had it. This overall, like
okay.
Kawasaki's disease and other inflammation related disorders.
Look, I'm
Rick,
not against. I'm sorry. Did you want to go?
Rick, yeah, as Maya said, nobody's against testing, but Rick, you've been brainwashed by the liberal media into imagining this fantasy world where somehow testing is going to happen and it'll save us. You can't save people with testing, first of all. The second thing is, it we can't wait months and months and months and go into something worse than a depression until you're comfortable that there are enough tests. The test is not gonna save us, and we can't wait for it. The third thing that you seem to be unaware of is this is a CDC statistic. Only a few thousand in the whole United States of people under 30 have died from COVID. People
Yeah,
under the age of 18, maybe a couple hundred. People under the age of 10, maybe two.
yeah.
And
I'm
even
I'm
that, they're
aware.
not
Well, I
true.
don't know about those
So,
exact
so what?
numbers, but
So no,
I'm
no, no,
obviously
no.
aware.
No,
I'm
but what
aware
I'm
that
saying is,
younger people don't die as much.
well, okay, but it's vastly, vastly more. We're talking about 80% of the deaths are people over 65. All right, everybody else is fine. And as a matter of fact, the if you listen to the counter epidemiologists, they say that the testing isn't really going to save you, Rick, because we've already got a huge amount of people in this country that either have it with no symptoms or have it with antibodies because they got through it. So I get nervous and angry when I hear about liberals thinking, oh, well, wait, we'll get these tests. See, that'll save us. And it may take a few months. It may take till January, but then we'll be able to test a lot and everything will be fine. No, fuck you. I don't want any more tests. I don't care
Oh,
about
no, no,
tests.
fuck you back,
What we
because
have to
what
do,
we
what we
found when
have
they
to do is,
hold on. When we went from 150,000 tests a day to 300,000 tests a day, if the fucking virus was what all the liberals thought, was just fucking running rampant and just nobody knew where it was, which is what I thought, I've been proven semi wrong, because when it was 150,000 tests a day, 20% of the tests turned up positive, about 30,000 a day. Now that it's 300,000 tests a day, less than 10% are turning up positive. It's
well,
like
Rick,
27,000.
Rick,
So frickin' those tests, even though they're not adequate, they are finding enough of the people that the number of people testing positive, the percentage of people testing positive, is going down. They are somewhat effective. And so
well, Well, what they're finding though is the more people they find have it, the more we realize that your chances of dying from it are going closer to 1,000 to 1.
Yeah,
Your
except
chances of dying
we're
from it is going down and down. So one more reason to end this lockdown and let people live their lives.
well, in the lockdown, but still in certain ways. Your insurance office wants to go back to work. It's 6 people. Okay, so everybody goes back to work. Everybody wears masks, and then if you can get everybody tested in that fucking office, it's masks off day when everybody gets their results. Fucking
Rick, I
just
don't want
like
your
I mean,
permission.
But
I don't
again,
want
that's
your
the,
permission.
one of those people. I'm sorry, Lance. One of those people can go to the store and pick it up from somebody else, and now they're coming back, and now they need to be retested, and you don't even know that. The thing is, though, it becomes. I mean, you're right. We had less flu because we were socially distancing, but to make this the quote unquote new norm is completely unacceptable. There should
well,
not be a new norm.
in other pandemics, you know, when you look at the dates of the pandemics, when they say 1918 Spanish flu, it wasn't 1918. It was 1918, 1919 Spanish flu. When it was the Hong Kong 1968 Hong Kong flu, it was 68, 69 Hong Kong flu because you, regardless of how you react to it, shit isn't normal for 2 years because the fucking virus doesn't. The Spanish flu existed in 3 waves across about 20 months. It comes in early 1918. It backs off a
Okay.
little bit in the summer. It has this huge explosion in the fall and winter of 18 and 19, and it backs off again. And then there's one more wave, and people, during the thick of the waves, people either took precautions or a lot of people died. So I mean, we as long we can get back to the disease is not going to let us get back to normal for roughly another year.
But our healthcare system is not what it was 100 years ago. So you can't really compare the waves that or the 20 months that it took. I'm going to argue that had we
Well,
not
if we
flattened
get
the
a
curve.
vaccine in less than a year.
Okay, but again, vaccine, are
Wait,
you going
wait,
to make it mandatory? Are you going to require that everybody gets it? Because again, we know that it only partially
well, all
effective
right,
and
fucking
only
make it. All right,
partially.
so don't make it mandatory. Okay, fine. Don't make it mandatory. Make it recommended. But make maybe. I mean, and I can't tell the president and vice president what to wear or not to wear. But I mean, kind of fuck them when they don't wear masks.
But neither does the press corps
But yeah,
sitting
okay,
in
make a
their press
recommendation.
briefings.
Make them strong.
I'm sorry? No, I said neither does the press corps when they're sitting in those press briefings. None of the press corps is wearing. I mean,
Well,
the
they are
people.
now. But all right, so they're assholes too if they're not going to wear masks on camera. So, but
And I agree. Like, if you want to require people indoor wearing masks, if there's a private business that requires me to put on a mask, I will carry one in my pocket. And if they require me to put one on, I will put one on. That's fine. But outdoors, to pull people over and tell them that they're being quote unquote assholes for not wearing a mask when they're outside in the sunshine and the breeze and the fresh air, which we now have, bless you,
bless
which we now have due to the fact that there are a lot less cars on the street and I can actually breathe the fresh air. And you telling me I'm an asshole for not wearing a mask? I think that's stupid. I think that absolutely. I'm sorry for being so simplistic, but it makes no sense. We have to
okay. I mean,
distill
and
common
okay.
sense,
I mean, I
and
don't. I mean,
the
I
fact
don't.
that you
We don't have
require
that
this.
much.
Go
I
ahead.
don't feel like maybe I haven't had enough coffee, but I feel like we don't have that much to argue about.
Wait, and there's one other point that Rick refuses to accept because he's been so badly brainwashed by his media.
I don't know.
Is
I'm agreeing with you guys left and right,
No,
so the
but
He is
brainwashing
agreeing.
can't be
Rick's
that
Yeah,
fucking
he is
bad.
agreeing somewhat.
Rick's media have convinced him that there is no treatment. And now it turns out, I said last week, there's a Republican treatment if you want it, hydroxychloroquine with zinc. And the Democrats have decided to accept remdesivir. It costs $1,000 per treatment, so it's a lot more expensive than the Republican treatment. But there are now two treatments. Since
Yeah.
when do we shut down the entire country when there is medical treatment available for this illness?
All right. So every week we talk about this, and every week I say, yeah, all the antiviral treatments are only somewhat effective.
Yeah, but
where
if your 99% chance of not dying, even if you get it and you just lie in bed, you have a 99% chance of living. But if you're given hydroxychloroquine or remdesivir, you now have 9 out of 10 of that. So it
well, it's not
reduces your
9 out of
chance of
10.
no,
The
yes it is.
antivirals
Yes it
help.
is, Rick. So
No,
it
no,
reduces
fucking
your
no.
chances.
Antivirals cut down mortality by, I don't know, about 40%, I'm guessing.
No,
I,
the doctors
yep,
in France and New York that are
yeah, but
using this
your
say that
doctors are
you have a nine
clowny.
out of ten
Your
chance of.
doctors are clowny lunatics. Like they just did. Columbia University published in the New England Journal of Medicine. Now they didn't throw zinc into the mix, so you're going to say it wasn't a legit study, but they
That's
just
true.
did.
That's
They
true.
just did a study of a semi double blind study. They did two populations of 1,400 people, and half of them got the hydroxy plus azithromycin, and half didn't, and they found no significant difference in the
Yeah,
out.
that's because you need to use zinc with it, and that's what all the doctors that are getting 99%, 90% results. Dr. Didier Rouault tried it on 1,060 people, and he got all of them to live except for six who were in their late 80s. So that's
Except that
and
the
he's using
overall, we
zinc.
don't even know what the overall mortality rate is. And as I've argued before, if the overall mortality rate is 2% and he tested 1,000 people, then you'd expect 20 deaths, and he got 6 deaths. So, and with statistical variation, you still can't tell, it didn't offer a 90% reduction, probably. It
Rick,
may have offered a
all
60%.
all of the doctors that are using this are getting uh, vastly superior results to if they weren't using the medication. Now, I want to go
But
on to something, Rick.
magically, when
Don't
they
interrupt
when
me.
the drugs are
Don't interrupt
tested,
me. Wait, I want to read something to you. This is Didier Raoult. Now, Maya, Rick fancies himself a scientist.
I
So
know I fucking write
these are
jokes for TV.
these are the
I just
awards. Wait. These are the awards that Didier Raoult got. Okay, Officier of the Legion of Honor of France, Commander of the National Order of Merit, European Society for Clinical Microbiology and Infectious Diseases Excellence Award, the Medical Grand Round Award of Chicago, the Sackler International Prize of Tel Aviv University, the
yeah I
INSERM Prize, France, the Grand Prix Scientifique de the Foundation of Louis D, the Institute of France. Is one of the most highly awarded scientists in the world. But Rick thinks, but the Democrats have convinced Rick that they can't trust him.
yeah no
Why is that, Rick?
I agree. They've
He's not
convinced
good
me
enough
that
for you, Rick.
no,
Why
it's
is
not.
that?
I know a guy. You might have heard of him. This is a guy who won the Nobel Prize, who spent the last 40 years of his life being wrong, working on a theory, the
No,
unified
that's Linus
theory.
Pauling, and okay.
No, let me
These
finish my
awards
fucking
for
point here. Let me
infectious
finish my
diseases
point.
and viruses,
Shut
Rick.
up, motherfucker! Shut up! This guy spent 40 years, the last 40 years of his life, wasted it being wrong on a theory that turned out to not be correct, that hasn't delivered any results. That guy was Einstein. The first half of his life, all the shit happened. The last 35, 40 years, he was dead. He pursued something that was wrong. And nobody had greater credentials than him. You can
Rick,
have kick-ass credentials.
Rick,
I've got,
I want you to take back your slander against Didier Rouault and
he's
admit that
bad
he's
at
one of
doing
the
these
most
kind of
qualified men
studies.
in the
He might
world.
be good at other shit. He's a good self-promoter, but he's bad at doing these kind of studies. And people who
You have
are
no evidence for that whatsoever, Rick.
I
All
have
these,
the journal that he submitted his study to. Uh, I don't know if they have rescinded it, but they were considering pulling that thing out of their journal after they looked at it and found that it didn't hold up. But I mean, there are studies that show there are. I mean, look at the. God dang it! Look at the people. Look at this. All this various studies of hydroxychloroquine. Some of them.
All of the studies with hydroxychloroquine, zinc, and Z-Pak have shown 5 times the rate of recovery that studies without them have shown.
I don't buy it. I don't.
Well, all right. So the Democrats have convinced you that this incredible
No,
science
no.
isn't good
What I
enough.
do is
But wait a minute.
what I do is
Isn't
what I fucking do
remdesivir?
is every week before the show I Google hydroxychloroquine plus zinc and azithromycin, and I try to read any new shit about it. And like the last thing I read was the New England Journal of Medicine study that
And they
shows that
used it without zinc. They used it without zinc.
so.
The people that are using it with zinc are getting incredible results. So Rick, you're
So why is
but Rick, I want to know if knowing that okay, so let's say the Democrats for some reason because it's $1,000 a dose, they like remdesivir. Why is it that now that we have a Democrat supplement to use, why is it that we still need to lock down the whole country when there's an actual treatment available for this disease?
Well, hold on. I've just spent the last fucking hour and 15 minutes saying we don't need to lock down the whole country, that there are reasonable things to do.
Then you are no longer a loyal Democrat, Rick.
No, fucking 45 states out of 50, and I don't know what's up with the other 5 states, are have opened up in this past week to some extent. Obviously, some more than others.
To some extent, may mean that you get to drive to a restaurant and stand out on the curb in front of it. That I've read those numbers. What the states that are opening up are the Republican states. The states that are locking down harder are the Democrat states. So I guess you're a Republican now.
No, I just think I believe in like fucking being reasonable about shit. That's it.
Well,
I mean,
reasonably good. So tell me, how reasonably am I supposed to go shoe shopping as a girl, as I'm going to go shoe shopping when you're telling me curbside pickup? How does that even make sense? It's
well,
either
fucking all right. Look, I'm not based on.
I mean, I realize it's a little pedantic, but still.
I like making shit. It's like when Lance is a legitimate artist. Have you seen Lance's work, by the way, Maya?
I have not. Send me links. I would love to check it out.
Oh, he's an incredible artist.
Thank you.
And there are 2 kinds of artists. There are like legit professional artists, and then there are people who do arts and crafts because they're disappointed in other areas of their lives. And I belong to the second group. I like doing little crafty shit to kind of distract myself from my other failures. So I like going to Michael's, which is,
Okay.
it's the arts and crafts store.
Yeah, it's an awesome
Right,
store.
all right. So fucking Michael's is so annoying under normal conditions because it's a huge cavernous store and you can never find anybody in there. They have like one person on the floor and so you're just wandering. It's like Home Depot but worse.
Mm-hmm.
They fucking closed this company. The Michael's company closed the entire my local store, so I can't even do curbside pickup because they have no curbside because they're on the second floor. And so I'm like, fuck that. They could open up Michael's because there's Michael's. You're never within like 50 feet of anybody else. So I agree with you. But I would wear a mask. I'd want everybody else in Michael's to have a mask on. But yeah, the fucking Michael's could open up, and a shoe store could open up, unless it's some crazy zoo where You know.
which it never is, and that's the whole point of with most businesses. So that's why I was saying before, it's like they shut down everything all at once. Nobody did a measured, reasonable, any kind of a step by step move. There was none of that.
Well,
There was
because there
just
was no
shut it
time,
all
because we
down.
didn't know
Yeah,
what was coming. Now we kind of know
right.
it came, and we're in the middle of it. And
And it's fine, and I'm willing to even concede the first couple of weeks, but we were told flatten the curve, and then it was something else. Then 10 days into April they extended it the 15th of May, and now it's just basically the governors and the mayors are just like basically drunk with power, as Lance was saying before, and they're just basically doing whatever they want. And I know that you agree with some of that, but my point is, and I think I'm backing up Lance here, is that if you're going to open up, just let it open up. Let people be reasonable, because for the same reason people don't drive 100 miles an hour, most people, right? Most people obey the traffic laws. Some are idiots and will drive 100 miles an hour, or some are idiots and drink and drive. Most people obey the traffic laws and do the normal things that most people should do. The people who are complete a-holes and drive 100 miles an hour and crash into other people and cause a six-car pileup, yes, there's a problem that happens. We know that. We don't reduce the speed limit to 20 miles an hour because we know that some people are just are not going to abide by any law. It doesn't matter, right? So I mean, as far as being reasonable, to say that, and then we still like considering the amount of devastation we already caused in these last 7-8 weeks, it's like adding insult to injury when you're telling restaurants to open at 25%, or you have to do you're making the restrictions. Let people be adults about it. Let them do what they know is the correct thing. So whether it's wearing masks, and honestly, if you look at all the employees, whether it's Home Depot or Walmart or whatever, they don't require the patrons to wear a mask, but they do require the employees. So if you're wearing a mask and the employee is wearing a mask, everybody's fine, right? So let the people make the decision for themselves, or for my little shop, whatever that happens to be, whether it's a shoe store or whether it's a takeout restaurant, whatever it is. It's just like with cleanliness, right? You're giving people grades, A, B, C, right, by the health department. How good the
now
restaurant.
you're talking about a whole new big bureaucracy where somebody comes into your store and takes a look at the width of the aisles and takes a look in your
But it's the same.
bathroom. And
But it's the same amount of bureaucracy that you're suggesting when you're saying step by step and measure, and now you've got the governor deciding that churches don't need to open until phase 3 or phase 5, or gyms don't need to be opened until God knows when, or whatever. It's like, again, you picking winners and losers. You deciding who's going to live and who's going to die, basically, from a business standpoint. So, and actually, what I was trying to, I'm sorry, I didn't mean to like this, what I was trying to look up is the name of the guy who came up with that study that this whole thing was based on, to begin with, the 2.5 million. The study that the name of the researcher, and I can't find it right now. I'll look it up later.
No, the
Um,
guy in Britain who turned out to be completely wrong and admits it.
Not only was he wrong, not only was he wrong in every single model that he modeled, and it wasn't just about this virus. He was wrong about other pandemics and on all the other viruses. But he was the one who ended up. I think just last week I saw that he got caught with, while he's telling you and me and everybody else to be shelter in place, don't do this, and then his mistress is coming over to his house, and she's married with 2 kids and all of this. I mean, I'm not even talking about the morality issue here. It's like, your morals are your morals, it's not my business. But the point is that he wasn't following his own guidelines, just the way Lori Lightfoot was getting haircuts while she was telling the Chicago people not to, just the way Cuomo was going to the gym when he was telling everybody else not to, or was it De Blasio who went to the park, and even on CNN, Cuomo's brother, Fredo, whatever his name is,
Yeah,
when he was telling
Chris
people
Cuomo.
what fools they are and whatnot. And while he was out, while he allegedly had COVID himself, and he broke quarantine, and he was out with his wife and somebody else, and that was that fat tire biker that he was referring to, that saw him and said, "Hey, aren't you supposed to be under quarantine?" So this whole like do as I say, not as I do. I mean, that's gonna continue if we just don't demand that it has to be open and the story. It has to be. It has to be, or we have given up all our rights. Now somebody's going to tell us when, what, who, how many, and it's just not going to work. It's not going to work because that's the freedom that we don't have anymore. I cannot believe that we've watched it just dissipate into thin air just like that
All
overnight.
right, all right.
wait,
That's
I need to respond.